1. A nurse is assigned to care for 4 patients. Which patient should the nurse assess first? 1. A 45-year-old post-op patient with a pain level of 6 out of 10. 2. A 60-year-old patient with pneumonia who is confused and restless. 3. A 35-year-old patient with diabetes who needs insulin before breakfast. 4. A 50-year-old patient who is due for a dressing change. Answer: 2. A 60-year-old patient with pneumonia who is confused and restless. 2. A nurse is delegating tasks to a licensed practical nurse, LPN. Which task is appropriate for the LPN? 1. Administering an IV push medication. 2. Initiating a blood transfusion. 3. Performing wound care on a stage 2 pressure ulcer. 4. Developing the plan of care. Answer: 3. Performing wound care on a stage 2 pressure ulcer. 3. A patient with chronic obstructive pulmonary disease, COPD, is experiencing shortness of breath. What is the nurse's priority action? 1. Increase the oxygen flow to 6 liters per minute. 2. Assist the patient to sit in a high Fowler's position. 3. Call the healthcare provider immediately. 4. Encourage the patient to lie flat to rest. Answer: 2. Assist the patient to sit in a high Fowler's position. 4. A nurse is caring for a patient who just had a total hip replacement. Which finding requires immediate intervention? 1. Pain level of 7 out of 10. 2. Scant serosanguinous drainage on dressing. 3. The affected leg is shorter and externally rotated. 4. The patient reports nausea after receiving pain medication. Answer: 3. The affected leg is shorter and externally rotated. 5. Which task can the registered nurse, RN, delegate to a certified nursing assistant, CNA? 1. Administering subcutaneous insulin. 2. Assessing a patient's bowel sounds. 3. Assisting a patient with ambulation. 4. Evaluating a patient's response to pain medication. Answer: 3. Assisting a patient with ambulation. 6. A patient receiving a blood transfusion begins to exhibit dyspnea, chills, and hypotension. What is the nurse's first action? 1. Stop the transfusion immediately. 2. Increase the infusion rate to complete it faster. 3. Notify the healthcare provider after the transfusion is complete. 4. Administer diphenhydramine as a preventive measure. Answer: 1. Stop the transfusion immediately. 7. A nurse is assigned to 4 patients. Which patient should be seen first? 1. A post-op patient with a blood pressure of 90/60 millimeters of mercury. 2. A diabetic patient with a blood glucose of 70 milligrams per deciliter. 3. A patient who received pain medication 30 minutes ago. 4th, a patient who is due for discharge teaching. Answer: 1. A post-op patient with a blood pressure of 90/60 millimeters of mercury. 8. A nurse is educating a patient on using an incentive spirometer. Which statement indicates the patient needs further teaching? 1. I should take a deep breath and hold it for at least 3 seconds. 2nd, I should exhale forcefully into the device. 3rd, I should use this device 10 times an hour while awake. 4. This device helps prevent lung complications after surgery. Answer: 2. I should exhale forcefully into the device. 9. Which of the following patients should the nurse assess first? 1. A patient with a potassium level of 3.8 milliequivalents per liter. 2. A patient with a sodium level of 135 milliequivalents per liter. 3. A patient with a magnesium level of 1.2 milliequivalents per liter. 4. A patient with a calcium level of 9.0 milligrams per deciliter. Answer: 3. A patient with a magnesium level of 1.2 milliequivalents per liter. 10. A nurse is caring for a patient with heart failure. Which intervention should the nurse implement first? First, monitor daily weights. 2. Assess for shortness of breath and edema. 3. Educate the patient on a low-sodium diet. 4. Administer prescribed diuretics. Answer 2. Assess for shortness of breath and edema. 11th. Which task can be delegated to an unlicensed assistive personnel? UAP. 1. Teaching a patient about fall precautions. 2. Measuring and documenting a patient's vital signs. 3. Administering oral medications. 4. Assessing a patient's surgical wound. Answer 2. Measuring and documenting a patient's vital signs. 12th. A patient with pneumonia has an oxygen saturation of 88%. What should the nurse do first? 1. Call the healthcare provider. 2. Increase the oxygen flow rate. 3. Encourage the patient to use an incentive spirometer. 4. Raise the head of the bed. Answer 4. Raise the head of the bed. 13. A nurse is caring for a patient post-surgery. What assessment finding requires immediate intervention? 1. Heart rate of 110 beats per minute. 2nd. Respiratory rate of 8 breaths per minute. 3rd. Pain level of 5 out of 10. 4th. Urine output of 35 milliliters per hour. Answer 2. Respiratory rate of 8 breaths per minute. 14. Which patient should the nurse assess first? 1. A patient with a blood glucose of 250 milligrams per deciliter. 2. A patient with a heart rate of 52 beats per minute. 3. A patient with a temperature of 100.5 degrees Fahrenheit. 4. A patient with a potassium level of 6.5 milliequivalents per liter. Answer 4. A patient with a potassium level of 6.5 milliequivalents per liter. 15. A nurse is about to administer digoxin to a patient. Which assessment is the priority? 1. Blood pressure. 2. Respiratory rate. 3. Apical pulse. 4. Oxygen saturation. Answer 3. Apical pulse. 16. A nurse is caring for a patient with a chest tube. Which finding requires immediate intervention? 1. Continuous bubbling in the water seal chamber. 2. Drainage of 50 milliliters per hour of serosanguinous fluid. 3. Gentle bubbling in the suction control chamber. 4. The chest tube is secured and properly placed. Answer 1. Continuous bubbling in the water seal chamber. 17. A nurse is preparing to administer medications. Which prescription should the nurse question? 1. Warfarin for a patient with an INR of 3.5. 2. Potassium chloride for a patient with a potassium level of 3.2 milliequivalents per liter. 3. Morphine for a patient with a pain level of 8 out of 10. 4. Furosemide for a patient with heart failure and a potassium level of 4.2 milliequivalents per liter. Answer 1. Warfarin for a patient with an INR of 3.518. Which patient should the nurse see first? 1. A patient with a sodium level of 145 milliequivalents per liter. 2. A patient with a blood pressure of 88/60 millimeters of mercury. 3rd, a patient complaining of mild nausea. 4. A patient requesting assistance to the restroom. Answer 2. A patient with a blood pressure of 88/60 millimeters of mercury. 19. A nurse observes a newly hired nurse providing care. Which action requires intervention? 1. Placing a patient in Trendelenburg position for hypotension. 2. Instructing a patient to use an incentive spirometer after surgery. 3. Encouraging early ambulation after abdominal surgery. 4. Administering pain medication 30 minutes before physical therapy. Answer. 1. Placing a patient in Trendelenburg position for hypotension. 20. A nurse is caring for a patient receiving total parenteral nutrition. TPN. Which assessment requires immediate intervention? 1. Blood glucose of 250 milligrams per deciliter. 2. Weight gain of 2 pounds in a week, 3.8 grams per deciliter. 4. Patient reports feeling thirsty. Answer. 1. Blood glucose of 250 milligrams per deciliter. 21. A nurse is caring for a patient with a Clostridium difficile infection. Which action requires correction? 1. Wearing gloves and a gown when entering the room. 2. Performing hand hygiene with alcohol-based sanitizer. 3. Using dedicated equipment for the patient. 4th. Placing the patient in contact isolation precautions. Answer. 2. Performing hand hygiene with alcohol-based sanitizer. 22nd. A patient is receiving a heparin infusion. Which laboratory value should the nurse monitor? 1. INR, 2. APTT, 3. Platelet count, 4th hemoglobin level. Answer. 2. APTT. 23. A nurse is caring for a patient with a nasogastric NG tube. Which finding requires immediate action? 1. Gastric pH of 4.0. 2. Greenish aspirate from the tube. 3rd patient reports nausea and abdominal distension. 4. Tube is secured to the nose with tape. Answer. 3. Patient reports nausea and abdominal distension. 24. A patient with hyperkalemia is prescribed sodium polystyrene sulfonate, Kxalate. Which assessment is most important before administration? 1. Blood pressure. 2. Bowel sounds. 3rd. Urine output. 4. Deep tendon reflexes. Answer. 2. Bowel sounds. 25. A nurse is about to administer a blood transfusion. What is the priority action? 1. Obtain baseline vital signs. 2. Flush the IV line with normal saline. 3. Verify patient identity with another nurse. 4th, monitor for a reaction during the first 30 minutes. Answer. 3. Verify patient identity with another nurse. 26. A nurse is educating a patient about warfarin therapy. Which statement indicates the patient needs further teaching? 1. I will avoid green leafy vegetables. 2nd. I will get my Indian rupees checked regularly. 3. I will take ibuprofen for headaches. 4th. I will wear a medical alert bracelet. Answer. 3. I will take ibuprofen for headaches. 27. Which patient should the nurse assess first? 1. A patient with a blood glucose of 250 milligrams per deciliter. 2. A patient with a heart rate of 112 beats per minute. 3. A patient who has slurred speech and facial drooping. 4. A patient with a temperature of 100.3 degrees Fahrenheit. Answer. 3. A patient who has slurred speech and facial drooping. 28th. A nurse is preparing to administer furosemide. Which lab value is a priority to check? 1. Sodium. 2nd, hemoglobin. 3. Potassium. 4. Creatinine. Answer. 3. Potassium. 29th. A nurse is educating a patient with heart failure about fluid restrictions. Which statement indicates the patient needs further teaching? 1. I will measure my fluid intake daily. 2nd. I can drink unlimited amounts of water. 3rd. I will weigh myself every morning. 4th. I should monitor my sodium intake. Answer. 2. I can drink unlimited amounts of water. 30. A nurse is providing discharge instructions for a patient taking digoxin. Which statement requires further teaching? 1. I will check my pulse before taking the medication. 2. I will take the medication at the same time every day. 3. If I see yellow halos around lights, I will notify my provider. 4th, I can take this medication with antacids. Answer: 4. I can take this medication with antacids. 31. Which nursing action is inappropriate when suctioning a tracheostomy? 1. Hyperoxygenating the patient before suctioning. 2. Applying suction for no more than 10 seconds. 3. Using sterile technique for the procedure. 4th, suctioning continuously while inserting the catheter. Answer: 4. Suctioning continuously while inserting the catheter. 32nd, a patient is prescribed enoxaparin, Lovenox. Where should the nurse administer the injection? 1st, deltoid muscle, toinen vastus lateralis. 3rd, abdomen, at least 2 inches from the umbilicus. Quartus, gluteus maximus. Answer: 3. Abdomen, at least 2 inches from the umbilicus. 33rd, a nurse is monitoring a patient post-thyroidectomy. Which finding requires immediate action? 1. Hoarseness and sore throat. 2. Calcium level of 7.8 milligrams per deciliter. 3. Heart rate of 88 beats per minute. 4. Mild neck swelling. Answer: 2. Calcium level of 7.8 milligrams per deciliter. 34. A nurse is assessing a patient receiving opioid pain medication. Which finding requires immediate intervention? 1. Respiratory rate of 8 breaths per minute. 2. Heart rate of 72 beats per minute. 3. Oxygen saturation of 96%. 4. Blood pressure of 118 over 72 millimeters of mercury. Answer: 1. Respiratory rate of 8 breaths per minute. 35. Which action by the nurse is appropriate when administering a bronchodilator via a metered dose inhaler? 1. Inhaling quickly and deeply. 2. Holding the breath for 10 seconds after inhalation. 3. Exhaling immediately after inhalation. 4. Skipping the spacer if the patient is an adult. Answer: 2. Holding the breath for 10 seconds after inhalation. 36. A nurse is caring for a patient with a new tracheostomy. Which action requires correction? 1. Keeping a tracheostomy obturator at the bedside. 2. Suctioning as needed using sterile technique. 3. Securing the tracheostomy ties tightly around the neck. 4th, assessing for bilateral breath sounds. Answer: 3. Securing the tracheostomy ties tightly around the neck. 37th, a patient with type 1 diabetes is diaphoretic and shaky. What is the nurse's first action? 1. Administer IV dextrose. 2. Check the patient's blood glucose level. 3. Notify the healthcare provider. 4. Give the patient insulin. Answer: 2. Check the patient's blood glucose level. 38th, a nurse is caring for a patient with a history of falls. Which action is the most effective fall prevention strategy? 1. Keeping all side rails up. 2nd, placing the bed in the lowest position. 3. Applying restraints as needed. 4. Turning off the bed alarm during sleep. Answer: 2. Placing the bed in the lowest position. 39th, a nurse is administering an intramuscular injection to an adult. Which site is the safest for administration? 1st, dorsogluteal. 2nd, deltoid. 3, ventrogluteal. 4, rectus femoris. Answer 3. Ventrogluteal. 40. A nurse is caring for a patient with a urinary catheter. Which action helps prevent catheter-associated infections? 1. Irrigating the catheter every 8 hours. 2. Keeping the catheter bag above bladder level. 3. Cleaning the perineal area with soap and water daily. 4. Clamping the catheter frequently to prevent backflow. Answer 3. Cleaning the perineal area with soap and water daily. 41. A patient with a history of myocardial infarction is prescribed nitroglycerin. Which statement indicates the need for further teaching? 1. I will take 1 tablet under my tongue at the first sign of chest pain. 2. I can take up to 3 tablets, 5 minutes apart if needed. 3. If the pain persists after 3 doses, I will go to the hospital. 4th, I should store my medication in a warm, humid place. Answer 4. I should store my medication in a warm, humid place. 42. A nurse is educating a patient with hypertension about lifestyle modifications. Which statement indicates a need for further teaching? 1. I will limit my sodium intake. 2nd, I will start walking for 30 minutes daily. 3. I will drink 2 glasses of red wine every night for heart health. 4. I will monitor my blood pressure regularly. Answer 3. I will drink 2 glasses of red wine every night for heart health. 43rd, a patient receiving vancomycin IV develops flushing, itching, and hypotension. What should the nurse do first? 1. Stop the infusion immediately. 2. Slow the infusion rate. 3. Administer diphenhydramine. 4. Notify the healthcare provider. Answer 2. Slow the infusion rate. 44th, a nurse is performing post-mortem care. Which action is correct? 1. Remove all tubes and medical devices immediately. 2. Keep the patient in a high Fowler's position. 3. Close the patient's eyes and place a pillow under the head. 4. Remove all valuables and send them to the morgue. Answer 3. Close the patient's eyes and place a pillow under the head. 45. A nurse is assessing a patient with a new colostomy. Which finding requires immediate intervention? First, pink moist stoma. 2. Small amount of gas in the pouch. 3rd, stoma that is dark purple. 4th, stool in the colostomy bag. Answer 3. Stoma that is dark purple. 46. A nurse is caring for a patient with a chest tube following a pneumothorax. Which action is appropriate? 1. Clamping the chest tube routinely to check for air leaks. 2. Keeping the drainage system below chest level. 3. Emptying the collection chamber every 4 hours. 4. Stripping the chest tube to maintain patency. Answer 2. Keeping the drainage system below chest level. 47. A patient with a history of seizures is admitted. What is the nurse's priority action? First, place the patient in a supine position. 2. Keep suction equipment at the bedside. 3. Administer lorazepam prophylactically. 4th, place the bed in a high position for easy access. Answer 2. Keep suction equipment at the bedside. 48th, a nurse is caring for a patient in Buck's traction. Which action should the nurse take? 1. Remove the weights every 2 hours to prevent skin breakdown. 2. Ensure the weights are freely hanging at all times. 3rd position, the patient in a high Fowler's position. 4. Massage the affected leg every hour. Answer 2. Ensure the weights are freely hanging at all times. 49th, a nurse is educating a patient on the DASH diet for hypertension. Which food should the patient avoid? 1. fresh fruits and vegetables. 2. Whole grains and legumes. 3. Canned soups and processed meats. 4. Low-fat dairy products. Answer: 3. Canned soups and processed meats. 50. A patient with cirrhosis has an elevated ammonia level. What dietary change should the nurse recommend? 1. Increase protein intake. 2. Decrease sodium intake. 3. Limit protein intake. 5. Increase fluid intake. Answer: 3. Limit protein intake.
If you found this video helpful, don't forget to like, subscribe, and share with your fellow nursing students. Hit the bell icon so you never miss an update. See you in the next one. Happy studying.